All right, I have 1 o'clock, so I'm gonna go ahead and get started. Hello, everyone. My name is Sarah Maynard, and today we will be discussing the medical applications of nuclear physics. I'm gonna share my screen with you real quick. All right, so today's presentation is on the medical applications of nuclear physics. My name is Sarah Maynard. A little bit about me. I'm a graduate of Old Dominion University's Nuclear Medicine Technology program. I'm currently a clinical assistant professor and the program director for the Old Dominion University Nuclear Medicine Technology program. Prior to working at Old Dominion University, I was the team leader for nuclear medicine at Sentara Norfolk General Hospital, and I have work experience in nuclear medicine, PET CT, and diagnostic CT, so we're going to talk about all of those during that presentation today. I'm a board certified nuclear medicine technologist and computed tomography technologist, and I have a master's degree in medical and health professions education from Eastern Virginia Medical School. So today we're going to talk about what is nuclear medicine, how is nuclear medicine unique, and what are the functions of a nuclear medicine technologist. So if any of you in the audience are like me, you may be wondering, what is nuclear medicine? When I was in school, I was on one of the athletic teams. We had to make a freshman buddy. My freshman buddy said she was majoring in nuclear medicine, and I said, what is nuclear medicine? So the more I looked into it, the more I found it was a perfect fit for me, and I'm going to share a little bit with you today about what nuclear medicine is. So nuclear medicine, we are a field of medical imaging. It involves administering radioactive substance to patients to diagnose or treat certain diseases. So we can give these radioactive materials in a variety of different ways. The majority of them are injected into the patient. Some of them can be swallowed or inhaled, depending on what disease process we're looking at. In most cases, we take pictures of these radioactive materials in the patient's body and send them to a physician for interpretation. So the radioactive substances that we give are called radiopharmaceuticals. So they can be broken down into a radioactive element that's detected by our imaging equipment and a pharmaceutical that'll make it go to a certain place in the body. So depending on what disease process that we're interested in, the radiopharmaceutical will localize in different areas of the body to diagnose or treat a disease process. So for example, this middle set of images here, this is a nuclear stress test. So it's a radioactive imaging material that shows us the blood flow to the heart muscle. We're looking to see if the patient has had a heart attack or maybe having one. We look for changes in between when the patient's heart is resting, and we take a snapshot of the blood flow to the heart muscle when their heart is stressed. So we lay the sets of images side by side, and we're checking for any areas of decreased blood flow. So what we want to see is a nice, fat, squishy donut between the rest and the stress. What we don't want to see is a big bite taken out of the donut during the stress. Another form of nuclear medicine imaging, it's actually a branch of nuclear imaging called PET, or positron emission tomography. We administer a radioactive sugar. Certain cancers will take up more sugar than the surrounding area, so they'll show up brighter in the image. So this right here is showing 3 different views of a lung cancer that's taking up more sugar than the surrounding area. So we do have different types of radiopharmaceuticals. We have diagnostic versus therapeutic radiopharmaceuticals. So most of the radiopharmaceuticals that we give fall within what's called the diagnostic range. So this means it's a really low level of radiation. It's designed to provide information on a disease process or show how the patient's body is behaving at a certain time. And we're going to go over some more examples of that in the coming slides. So therapeutic radiopharmaceuticals, on the other hand, contain a higher level of radiation, and they're designed to treat a certain medical condition, such as cancer or an overactive thyroid gland. So for example, this set of images right here is called yttrium-90 SIR spheres. So they are microscopic spheres filled with a beta minus emitter, which is a little particle that packs a lot of punch. So the physician will go into one of the arteries in the patient's liver. They will find the liver tumor and they will deposit these microscopic spheres, and the radiation will destroy the liver tumor and try to preserve as much of the healthy tissue surrounding it as it possibly can. So this is what it looks like on a CT scan. We'll cover this in a couple minutes, but that just shows the anatomy of the tumor in the liver. This is the images of where the therapy is actually targeting. And when we fuse it together, we can actually do some calculations to figure out what percentage of the tumor was hit by this radioactive material versus what part of the liver was preserved, and make sure we're not hitting too much of the healthy tissue in the liver. So it's a really fun, exciting therapy to be a part of. So nuclear medicine imaging, the images in this slide were obtained using what's called a gamma camera. So this is a complicated machine which will detect that radioactive material coming from the patient and use that information to create an image. So inside this plastic rectangle here is the nuclear medicine gamma camera. It's a crystal. It'll convert those gamma rays into an image that can be processed and interpreted by the computer and recorded for the physician. So the patient usually lays on the table here. We usually have one camera above, one below. We can rotate these in a variety of different ways. We can rotate them 360 degrees around to get a 3D image of the patient, just depending on what we're looking at. So some examples of nuclear medicine images that we obtain. This is kind of a bread and butter of what we do in nuclear medicine. It's called a nuclear medicine bone scan. So it's a radioactive imaging material that shows us where the bones are rebuilding themselves. So the bones can rebuild themselves for a variety of different reasons. It could be from cancer, could be from a fracture, it could be from an infection. So in this imaging material here, what we're looking for is a nice symmetrical distribution in the patient. So this is pretty symmetrical. We'll also see the urinary system because that's how it gets out of the patient. So you'll see the kidneys and the bladder here. So other than some stuff going on in the shins and the toes there, maybe this patient was a runner, we have a nice symmetrical distribution. So this one to the right here, this shows a patient who has widespread cancer within their bones. So we don't see as symmetrical of a distribution. We see little dots all within the bone, all throughout the skeleton. This part of the skeleton, called the axial skeleton, is brighter than the long bones at the body. So if a patient is first diagnosed with certain types of cancers, they'll usually undergo one of these studies to figure out if the cancer has spread to the bones. So now that we understand a little bit about what nuclear medicine is, we're going to talk about how nuclear medicine is unique and how it differs from some other types of imaging. So nuclear medicine shows us physiologic or functional imaging, whereas other types of imaging mainly rely on changes in your anatomy to convey differences in disease processes. So we're going to talk about one specific disease process, and we're going to go through different types of imaging to show the differences between nuclear medicine and other types of imaging. So we're going to talk about your gallbladder. Your gallbladder is a small organ. It helps you digest fatty foods. If it's not functioning very well, the patient can experience abdominal pain, nausea, sometimes some vomiting. So what we do, we administer a radioactive imaging material, and it's going to mimic the path that bile will take through the body. So your liver creates bile, it goes through your bile ducts into the gallbladder, and then empties into your intestines to help you digest fat. So for the patient will lay under the nuclear medicine camera and it'll take some images. And what we're trying to see is if that path leading into or out of the gallbladder is blocked. So on this patient, it looks good. I see the liver, I see the gallbladder, and then I see it empty into the intestines. So we're good to go. Just because that pathway is open still doesn't mean your gallbladder is working properly. So for the second part, we give essentially a cheeseburger in an IV bag. So when you eat a fatty meal like wings or a cheeseburger, your gallbladder will squeeze to help you digest that food. It'll squeeze out bile. So we're going to mimic that process, and we're going to take another 30-minute video, and in the end, we'll actually calculate how well the gallbladder squeezes. So what percentage of bile it squeezed out in that time period. So this patient only squeezed 26%. So normal is anywhere above 35 to 50%. So this patient, while their gallbladder pathways are not completely blocked, their gallbladder is still not working as well as it should. So I'm sure everyone in the audience is familiar with an X-ray, and most of you have probably had an X-ray at some point in your life. An X-ray uses radiation coming through the patient to create an image of what structures look like in the body. So nuclear medicine, we put the radioactive material in the patient and the camera will detect that radioactive material. An X-ray, that radiation goes through the patient, shows us what things look like. The only problem with that is it's kind of like taking a picture of a loaf of bread just from the front and the back. You can see the front piece, but you can't see what's in the middle. Are there nuts in there? Are there raisins? Are there berries? Is there nothing? Everything is smushed together on top of each other. So an X-ray of the patient's abdomen, I can't even see the gallbladder. I see that there's some organs in there, but everything, the bones, you see the spine there, the hips, I see the intestines here, those black parts. I can sort of see the liver, it's that light gray part there. So everything is just kind of superimposed on top of each other with the liver, spleen, and everything like that. So a computed tomography, also known as a CT scan or a CAT scan, will take a bunch of X-rays rotating all around the patient so we can really take the slices of bread that are inside that loaf and really pick apart and see what's going on inside. So if you think about it, this is like taking a slice of bread. We can look at it in the computer from top to bottom, from side to side, or from front to back. So this is still X-ray imaging, but it's just recreated in the computer in a 3D way. So here I can identify the gallbladder. The gallbladder is, you can see where the arrow is pointing, this like medium gray circular structure there. However, we're relying on changes in the structure of the gallbladder to show us changes in how it's working. So are there stones in there? Is there fluid around it? Is it swollen? We're relying on changes in how it looks to convey changes that it may not be working properly. Some of you may have also heard of magnetic resonance imaging, or MRI. So MRI, instead of using radiation like X-rays or nuclear medicine gamma rays, it uses magnets to create an image. So the images are very detailed, they're very beautiful, but in most cases, MRI still relies on changes in the structure to convey changes in how it's functioning. So in this one, the gallbladder is this brighter gray circular structure again. So we're still just showing what the gallbladder looks like, and in most cases, we're not getting information about how the gallbladder is working. MRIs are also rather expensive. Patients who have metal implanted in certain parts of their body are unable to undergo certain types of MRIs. And it's also very claustrophobic and very loud. So some patients aren't able to hold still that long and tolerate that for 45 minutes to an hour. An ultrasound is another imaging modality. So an ultrasound uses sound waves to create images within the patient's body. So again, in the case of the gallbladder, the ultrasound is relying on changes in how the gallbladder looks to convey changes in how it's working. So what we see here is the gallbladder. You can see this one's labeled gallbladder wall. So there is a stone within the gallbladder. It could mean that the gallbladder is not working, but having stones in the gallbladder doesn't necessarily mean that it's not working. And the presence of a stone doesn't necessarily tell us, is it blocking anything in the pathway? Is it still sort of working? So that's where nuclear medicine comes in. So advances in the field of nuclear medicine have helped to combine the benefits of that physiologic information, or how things are working, with the anatomical information provided by a CT scan. So through a computer reconstruction process, we can get the best of both worlds and fuse that nuclear medicine information with a CT scan, so it can show us where exactly things are functioning in the body. So this study right here is called a parathyroid study. You have 4 tiny parathyroid glands, usually located on the backside of your thyroid gland. They help to regulate calcium levels in your body. If one of them is more active than the rest, we're usually not sure which of the 4 is more active than the rest. So we can inject a radioactive imaging material that shows us increased blood flow to a certain area. And if one of those parathyroid glands is more active than the rest, it'll get more blood flow. So in the center here, this is showing the patient's neck and the parathyroid gland. So that's great that that information is lighting up, but it's really not showing us where exactly it's occurring in the patient's neck. So when we fuse it with a CT scan, on the CT scan, it's really hard to see a parathyroid gland at all, or where exactly that one, it's impossible to tell if one is overactive. So when we fuse them together, a head and neck surgeon can see where exactly that parathyroid gland is overactive and where exactly in the neck it is located. So the third thing we're going to talk about today is, what are the functions of a nuclear medicine technologist? So one important function of a nuclear medicine technologist is making sure that our instruments are working properly. So we are creating these great images, we're administering radioactive material. So our job is to make sure that we're doing this safely, effectively, and providing the best images and safety for the patient, as well as for ourselves. So a lot of our role every morning is making sure that the imaging equipment is working properly and creating accurate images for the physician. Another important element of a nuclear medicine technologist is making sure that our equipment is functioning properly. For example, this is called the dose calibrator. So this measures exactly how much radiation is in the dose prior to when we give it to the patient. So I know if I was only prescribed to get 25 of a radioactive dose, I don't want anyone giving me 50 or 75. So we have to measure how much radiation we're giving to the patient prior to administering it. And we have to make sure that this machine is functioning properly and making sure it's reading the correct amount before we give it to the patient. At the end of the day, since we are literally handling radioactive materials all day, every day, this is one instance where we don't want to take our work home with us. So at the end of the day, we use one of these instruments. If any of you have ever seen Chernobyl or other shows on Netflix, this is a Geiger-Muller counter. So it's checking that I didn't spill any radiation on myself or in my work area before I leave for the day. Another really important part of what a nuclear medicine technologist does is making sure that the patient is prepared properly. So if we're talking about how the body functions, there are certain medications, there's certain medical conditions that can impact your results. So for example, if the patient is getting a scan for cancer, and they recently had a rib fracture, that's really important information because that could show up as cancer when really the patient fell and just fractured a rib. So you wouldn't want them to undergo unnecessary chemo, radiation, or anything like that because of false information on your scan. So the technologist must understand how the radiopharmaceutical works and how it can impact the results, as well as check against medications and conditions that can affect your results. Also, we see patients from all backgrounds and all walks of life. So we have to be able to make the patient comfortable and explain what we're doing in a way that patients can understand. This is a picture of one of my students practicing an IV on me before she learned how to do it on patients. She did great. Another important role of the nuclear medicine technologist is radiation safety. So we handle radioactive materials all day, every day. So it's a small amount of radiation one time for the patient, but it can add up to a lot for us. So a role of ours is making sure that we are keeping others safe from radioactive materials, as well as keeping ourselves safe. So one way that we do that, if you've ever had an X-ray and seen them wear the lead aprons, we shield our radioactive materials when we hold them, and this is called a syringe shield. So it goes around the syringe to protect me while I'm holding it. They are shipped in these lead containers called a lead pig. And when we're carrying them around the hospital, if I have a 7-minute walk to go administer radioactive materials up on a floor to a patient, I don't want to be holding that unshielded dose the entire time. I want to put it in some lead and decrease the dose that's actually getting to me. One of the largest roles of a nuclear medicine technologist is imaging. The technologist is responsible for operating the gamma camera. So they must not only understand the image acquisition settings and how to make the best possible images, but how to make the patient feel comfortable and ease their anxieties about the test and the patient's clinical situation. So this is really one of the things that drew me to nuclear medicine. I love math, I love science, I love engineering, but I really love the people aspect of nuclear medicine as well. So it's really neat to be able to bond with certain patients and really get to know them on a personal level while still doing calculations, doing math, doing science, and understanding the engineering of these complicated systems. So this is probably one of my favorite parts of nuclear medicine is image processing. So following patient imaging, our role is to prepare the images for the physician. We make adjustments to the computer reconstruction process to ensure we're creating the most beautiful and accurate images. And for certain studies, and the part I really enjoy, is doing calculations to calculate physiologic information for the physician. So for example, this top set of images here, this is called a gastric emptying study. So the patient will eat radioactive eggs. We mix in a radioactive imaging material with eggs. We cook it in the microwave. It's delicious. We take a picture immediately after the patient finishes eating, 30 minutes after, an hour after, 2 hours after, and 4 hours after. So each picture, we calculate, this is 100% of the food in the stomach. So by the end, we calculate how much of the food has emptied from the stomach. So this tells us, is the patient digesting food too fast, too slow, or just right? Another one here, this is called cardiac amyloidosis, which is a plaque buildup in the heart. If the patient does have cardiac amyloid plaque buildup, it can cause congestive heart failure. But the presence of this plaque can help guide what medications treat the congestive heart failure. So what we do is we measure how much of that plaque is in the anatomical area of the heart. versus the lungs, which is just the background of how much is floating around in the patient's body. And we're trying to see if a certain percentage is in the heart versus the surrounding area. So that's one of my favorite things to do. Another important, although maybe not quite as interesting, role of the nuclear medicine technologist is accreditation. They must make sure we're adhering to several accrediting bodies to make sure we're keeping our patients safe, our staff safe, everyone in the general population safe from radiation, and that we have good quality images. So we are subject to certain reviews and visits and audits by the Nuclear Regulatory Commission, state representatives, hospital safety accrediting bodies, and then other accrediting bodies that evaluate the quality of the images that we're creating. So in summary, nuclear medicine stands out by its ability to provide information about how the body is working. It provides an opportunity to apply critical thinking skills to process images and perform calculations. So it's a very exciting, fast-paced, growing field that combines science, technology, math with patient care. So thank you all for your time and attention. And I wanted to open up the floor to any questions. And here is my contact information if you are interested in the Nuclear Medicine Technology program at Ultimate University. Did we have any questions? So we have a great question. What types of doctors use nuclear medicine? Do I have to hit answer live for this, or Scott?
You can, yes.
Okay. So the types of doctors that use nuclear medicine, all types of doctors. Cardiologists will send us patients to evaluate if the patient's had a heart attack. General care physicians will send us patients for just general imaging for abdominal pain. So the images are interpreted by a radiologist who specializes in interpreting X-ray, CT, MRIs, specializing in nuclear medicine or PET. And some of the cardiology images are read by a cardiologist or heart doctor. So how many years of education do you need to become a nuclear medicine tech? So that varies a little bit based on where you live. There's 3 types of programs in the United States. There's certificate programs where you have another degree and complete just nuclear medicine training after you finish that degree. There's associate's level programs throughout the country, and the 2 programs in Virginia, including the one at Old Dominion University, are 4-year programs, so they're bachelor's degree programs. So I had another question that says, seems interesting in case I decide not to be a surgeon. So nuclear medicine is always a really great starting place. A lot of people will, once they get a job in nuclear medicine, it's a great job. Some of them don't leave until they retire or move. But a lot of other people have gone on to be nuclear pharmacists, radiologists, physician's assistants. So it gives you a really good understanding in physiology and is a great building block if you decide you want to do more. But a lot of people decide to stay in it because I will say it's a great job. So another question was, is there a certain kind of hospital that specializes in caring for patients that need radiopharmaceuticals? No, almost every hospital in the United States will have a nuclear medicine department. Some are larger than others. Some of the therapies are done in a separate oncology department or only at the larger hospitals. But almost every hospital, and there's a lot of outpatient standalone facilities as well that do nuclear medicine. So this question, do you know how nuclear medicine technology is developed? So I think it's relating more towards the radiopharmaceuticals themselves. So they either come to us from a nuclear reactor, a generator, or created in a cyclotron. And so they spin down the actual radioactive element that we're looking at and send that to us directly. And if you have a follow-up question on that, feel free to clarify, but I think that's what you're asking. How long has nuclear medicine with radioactive injections been around? It's been studied for a while, since the beginning of the century, but in the 1970s is really when it started to become more widespread. That's when the gamma camera was developed. So they were studying it before in animals and somewhat with people, but it really became more widespread in the 1970s with the advent of the gamma camera, also known as the Hal Inger camera. So somebody else asked, hi, I would like to know about the safety of using radioactive compounds in the human body, like how many exposures is recommended. So that's actually something that we track with every patient, but it's always up to the ordering physician on a risk-benefit scenario. So sometimes if we're trying to figure out if you had a heart attack or you had a blood clot in your lungs, sometimes the risk of a little bit of radiation may be worth it to try to find a life-threatening condition. So it's always up to the ordering physician. So sometimes, especially with pediatric patients, the younger the patient, the more susceptible they are to radiation. And the greater radiation dose over time, the more susceptible the patient is to negative effects, like potentially developing cancer, but it can be a risk-benefit scenario. Sometimes if the patient already has cancer and we're trying to figure out how bad is the cancer, we need to guide your treatment. Sometimes the risk of a little radiation is more beneficial to the patient. So are there any alternatives to radiopharmaceuticals if the patient is allergic to them? Yes, there are alternatives. It is extremely rare for a patient to be allergic to radiopharmaceuticals. Some of you may have heard of allergies to the CT contrast that they use, but the allergies to what we use are extraordinarily rare, like a handful of cases reported ever. So what it does, it actually mimics the natural processes in the body. So it is very rare for a patient to be allergic to it. Of course, it does happen. But there are alternatives. We can use anatomical imaging instead, like an MRI, an ultrasound. So we may not get the exact information that we're looking for. And sometimes this is the best test, but we can usually find an alternative if necessary. Did anyone have any other questions? I'll give one more minute for questions, I guess. And then, Scott, I guess we can end if there's no other questions. That's what I was told.
Okay, you got it.
I have a question in Spanish, which I'm not fluent. I do have one more. Are there typically any side effects amongst patients after the use of radiopharmaceuticals? Not normally, because it is mimicking the processes that are naturally occurring in the body. Sometimes we give other medications to mimic processes in the body. Like we have a medication we can give if the patient is unable to walk on the treadmill to stress the heart. So those medications can cause side effects in the body, like the patient may feel hot, flushed, warm, short of breath, like they were exercising. But the actual radioactive materials themselves don't usually cause any side effects unless they are the higher doses that we use to try to, say, treat cancer. All right. Anyone else have a question? Give it one more minute and then we can end, Scott. All right, well, thank you all again. I really appreciate it. Feel free to email me if you have any questions about nuclear medicine, the program, anything like that. I'd be happy to chat with you, and I really appreciate it. I hope you learned something.